Let me introduce myself and then I'll tell you why we are doing these modules and how you will all will get benefit from it. See, my name is Dr. Rajat Goyal. I did my MBBS in 1997 from Maulana Azad Medical College, Delhi. Then I did my MS from Lady Harding Medical College, again Delhi. Then I did my SRship for 2.5 years in Lady Harding Medical College. After that, I went to Singapore for 3 years, where I did my fellowship in minimal access surgery. Then I did my bariatric fellowship from Taiwan. Then from 1 month I was in US, where I did observership at Cleveland Clinic, Florida. And from 2012 I am practicing bariatric surgery in Delhi. For 7 years I was the head of Primus Super Speciality Hospital, Chanakyapuri. But now I have my own setup at Lajpat Nagar, New Delhi. And because teaching is my passion, so I want to all of you to know what exactly is bariatric surgery, because there are a lot of wrong things and myths about it. Now there is a new kid on the block, Allurian balloon. But we are doing Allurian balloon or a weight loss capsule pill for last 1.5 years. We did our first case in Delhi, and we have done the maximum number of cases in North India. So I have made 12 modules for 3 months. Every Friday, 5 to 5:30, we will be meeting together. And after the 3 months, you will know everything about bariatric surgery. What are the diets? How we treat our patients? We will also take your input to improve. What is Allurian balloon? How we treat our patients, and we will take your input as well. Number three, what are the activities or exercises? When can we start? When can we start the protein? And what happens if the patient gains weight? So these are the things you all will see. See, all of you are very good dietitians, but I want you to become excellent dietitian and the best in your area, wherever you are practicing, which hospital you are practicing. And if somebody are good, and I have few patients all over India, so I'll ask them to manage locally, and they will meet you and start the process as well. So we have a partnership program as well. Those people who are very much interested, Amir will share a partnership formula with you. So everybody gets benefited. You all basically learn as well, also earn money as well, because we have patients all over India and from abroad as well. So this is why I want you to learn about bariatric surgery, about balloon. So that will add a lot in your career. And I think in future, this is the things everybody, a lot of patients, after they underwent surgery, the surgeon asks them to follow with the dietitian, but the dietitian doesn't know what to do. So maybe basically after these programs, after 3 months, you will know what to do, and maybe you will know a lot of things which a lot of doctors doesn't know, or a lot of surgeons doesn't know, who are not doing bariatric surgery. So I have made 12 modules. So we have already done 15,000 laparoscopic surgeries, around 2,000 bariatric surgeries, 100 Allurian balloons, and I have designed this module only to tell you what is bariatric surgery actually. See, a lot of times when the patient undergoes surgery, even they don't know which surgery has been done. And so, because every surgery follow-up is little bit different, the nutrients requirement is different. So I have taken only three major procedures now, which are done all over the world. One is sleeve gastrectomy, second is RYGB or gastric bypass, and third is mini gastric bypass. There are around 200 procedures now, but these three procedures are most common all over the world and all over India. So whenever you meet a patient, you should ask them first which surgery they have undergone. Amir will share a video how to prepare for a bariatric surgery. He will share all of you how a patient should be prepared when they comes and meet the surgeon as well as you. On the first meeting, what things they have to take in mind. So this is the first procedure, which is known as sleeve gastrectomy. See, everybody have seen the sleeve of the collar. Idea is to make the stomach in a sleeve of a collar. And this, how this is done, we introduce a bougie which is 36 French inside the stomach during the surgery, and all the excess stomach is stapled. So these are special staplers from US. I use only Medtronic staplers, which are the best. They have 3 rows of staples. So once you cut and staple, the stomach, the excess stomach is disconnected, and also there are 3 rows of staple line now there. So this staple line is 3 rows, 1, 2, and 3. So this is very safe. And after the surgery, I also do suturing. This adds to the safety. Also, I do a leak test during the surgery. I block this hair, and put a dye inside, which is methylene blue, and inflate the stomach. So if there is any staple miss happening, I detect it at the surgery only and repair it. So this is my technique where we do sleeve gastrectomy. The stomach which has been cut is removed through one of the ports. We don't need to cut the abdomen to remove this stomach. So this is one procedure. How it helps in weight loss? See, there is a hormone here. Understand that bariatric surgery is a hormone changing surgery. Obesity is a hormone disease. Bariatric surgery is a hormone changing surgery. And whoever patients they plan for bariatric surgery, they have already tried diets with 8 or 9 dietitians or more, and they keep on switching dietitians, and they lose weight and also they regain fast because there are few things they cannot control. See, nobody wants to be obese. So what happens in bariatrics, this sleeve gastrectomy, like this hormones, like ghrelin hormone is there, which is removed during the surgery because it is produced by the area of the stomach. And after 3 to 6 months, the other areas of the body start producing ghrelin during that time, because ghrelin hormone is a hunger hormone. So if the ghrelin hormone is removed, the patient feels full, not because they are forcing themselves, but it is natural. So this is how this bariatric surgery helps in a volumeter. And also when the food comes here, it travels down fast, and there are some hormones which are released known as GLP-1 and GIP, or pancreatic bye-bye. These are the hormones. Now injections have come for weight loss, tablets have come from weight loss. These are the same injections and hormones having these hormones as the base. So these are increased, which act like insulin and helps in weight loss. So bariatric surgery, how does it help? It helps in two ways. First, the restriction is there because the stomach size has been reduced. They cannot do volume eating. If they try to do volume eating, they will feel nausea and they won't be able to do volume eating. Second, there are hormone changes which are helping the patient to eat less. And just imagine a patient becomes a newborn baby. Initially, they will be on sips of water, then liquids, then slowly they will be shifted to soft diet and the normal diet. But that normal diet will also be like not like before. If they were eating 3 to 4 chapatis, imagine at one time after the surgery, they will be taking one third of that. That is 1.5 chapatis. Then people will think that they will become weak. They will not have enough nutrients. It is not like that, because if they eat the right food, they will not have nutrient deficiencies. And previously they were taking 2 or 3 heavy meals. Now they have to take 4 or 5 small meals, but in quick interval of time. So this is first surgery. Now we go to the second surgery, which is known as Roux-en-Y gastric bypass. See, you are all living in metropolitan cities. There is a bypass which basically help. There is a kind of a shortcut to reach your destination. So this procedure is like a bypass, which means the same. So what happens to the food when it comes into the stomach? After this procedure, we create a small stomach pouch, which is only 30 to 40 ml, and connect it to the intestine below, which is around 100 centimeters. Our intestine length is 6 to 8 meters, and we want to bypass 1.5 to 2 meters. So already 4 to 6 meters are still there. So the food will come here, which is known as alimentary limb, and the juices will come here, and both of them, the digestion of the food will start here. So approximately 2 meters of the intestine is bypassed. This is how this procedure works. Food is coming here, the nutrients are coming here, and digestion starts here. So you need to know whether patient has sleeve gastrectomy or a Roux-en-Y gastric bypass. And how does it help in weight loss? Again, stomach pouch is small, so the patient will eat less. They will not do volume eating, and also the food is going faster in the distal intestine. The GLP-1 release is much higher. So patients who are diabetics, they are benefited a lot after this procedure. We generally as a routine do as a standard sleeve gastrectomy for any patient who is non-diabetic or diabetic less than 10 years and not on insulin. If the patient is on insulin or more than 10 years of diabetes, then gastric bypass can help them achieve a good remission of diabetes after the surgery. So this how this procedure is. The stomach is inside. We don't remove the stomach outside. This remains inside the body. So this is Roux-en-Y gastric bypass. But imagine there are two joints. One joint is here, one joint is here, and two also two more we have to close two more defects. So total there is four. So that is why this procedure came, which is known as mini gastric bypass. It is a combination of sleeve as well as RYGB. What happens is the stomach pouch is big, it is 100 to 150 ml, and there is only one connection. This is also a bypass, but the connection is only one. So at 1.5 to 2 meters, the bypass is done. So the connection is only one, and there are fewer connections. So the chances of staple leak, bleeding, and other things, they are less after this bypass procedure. And this has overtaken Roux Y gastric bypass now. So most of the times people are doing sleeve or mini gastric bypass. So these are some of our patients who have undergone this surgery, and you can see the difference in them. I am not saying bariatric surgery is the solution for obesity. I am saying people who are obese, whose BMI is more than 40, they need bariatric surgery, or BMI is more than 35 with diabetes, or two more diseases like hypertension, sleep apnea, fatty liver, joint pains, or osteoarthritis, primary infertility due to polycystic ovarian disease. These are all candidates who benefit a lot after bariatric surgery because of hormone changes. Any person who wants to change his lifestyle, dieting and exercise are the first options. And what bariatric surgery is doing, it is not replacing dieting or exercise. It is just helping them to do the diet and exercise which they are not able to do. So bariatric surgery is adjunct to the people who wants to lose weight, but some because of their weight they are not able to walk, they are not able to do exercise, and they have no control over their diet though they want to lose weight. Do you can see the changes. Some of these patients have gained weight because they're all 8 to 10 years old pictures, and some of them have gained some weight. There is another module which tells us what are the reasons some people gain weight after bariatric surgery. So I think it's, you people have treated a lot of people for weight loss, you must be having your photographs, and you must be doing a very good job with your dietary things as well. But somehow there must be few patients who were not losing weight as you expected, or they have regained weight after losing weight. On in those kind of patients, bariatric surgery can be an option to go for healthy diet and exercise, because they were not able to do the exercise because of overweight. So I think if bariatric surgery is done in selected patients, done with proper all the tests, done with proper care, it is very good in selected patients, not in all. So I think when you see these pictures, you can imagine how people have changed. And I am very happy if I am able to change even one person's life for the good, and you all are doing regularly, because our surgery patients are quite less and your dietary patients are quite more. So I think you can contribute to the society in a way where everybody becomes fit. See, there are lot of advertisements around which speaks only of food. So patient is like addicted to food because he sees only food everywhere. So his stress buster is food. So you can see all the age groups of patient. Younger age groups get surgery done to get married, older age groups get surgery done to relieve their joint pain. And these are extreme cases, like we had to do this 8-year-old boy, though I do only cases between 18 to 65 years, and we had to do this case on a 70-year-old lady with insulin of 100 units. This she did well for 5 years after the surgery, and he had a sleep apnea, so we had to do this surgery, and after that the patient did well. So these are extreme cases. Now because you people are doing a lot of weight loss with your clients, so and on all the modules I give you one tip. So this is implementation intention. What does it means? See, if you give a chart to a patient, they may not be able to follow it completely. And then they will say your diet has not worked, but your diet was correct. So what does implementation intention means? That whenever you want somebody to follow your instructions, ask them to speak loud and write on a paper. Like, I will eat tomorrow 9 o'clock paneer sandwich. I will take protein shake tomorrow morning, tomorrow afternoon at 12 p.m. If they start doing this, imagine that their follow up with you, or their following your instructions will increase a lot, because the brain is works like that. unless you tell, lot of people have done, I have also done, when you sleep in the night you tell your pillow, I will get up at 6 a.m., please help, and you at 6 o'clock your eyes open though there is no alarm. So this implementation intention is the same thing. So try to implement one thing at a time every day, with the time, with a specific space. Like you tell them, tomorrow morning I will go this park at 8 o'clock and do 30 minutes of walking. Ask them to write it on a paper and revise it 3 4 times, and just see that the results will come. So this is my tip of the day for this module. There are 12 modules. Amir will send you all the module details if he has not sent it till now. So this is the lecture for today, and we are open for questions. So anybody has questions, they can go ahead. And don't be afraid that what other people will think, because we only learn if we ask, and nobody is judging you here. If you ask now, you may help somebody save their life. Yes, I think everybody has understood everything. This is a surprise. Please go ahead. Go ahead. Go ahead. Ask questions.
I think
I
you.
wanted to ask that,
Yes. View
yes,
plus, just tell me your name and ask the question. Yes, yes, go ahead.
this is Pallavi. I
Yes.
wanted to ask that what are the criteria for selecting the patient?
Excellent.
There, yes.
Just calculate by body mass index, which I think all of you know how to calculate. Weight, you have to take weight in kgs, height in meter square, divide weight in kgs by meter square. Suppose somebody has a weight of 100 kgs and a height of 1.5 meters. So multiply 1.5 into 1.5 and divide that amount by 100. So you will get a BMI, body mass index. If BMI is more than 40 or BMI is more than 35 with diabetes or any other two diseases associated with obesity like hypertension, sleep apnea, fatty liver, joint pains, uh, polycystic ovarian disease, they are all candidates for bariatric surgery. Yes, any other question? Understood?
Yes, and for diabetes patients, if their blood sugar is uncontrolled, then in that case, how it goes ahead, like for
Okay,
the blood sugars are suddenly brought down with the help of medications, or how it is?
excellent. Who is this? Pallavi only?
Pallavi, yes.
See, anybody who is diabetic, lot of times people are doing this surgery as a surgery to treat diabetes. This surgery will not cure diabetes, but will help remission of diabetes. What does that mean? It means that because of hormone changes, the patient who is diabetic, their blood sugar improves, and sometimes their medicines are also stopped. Sometimes people who are on insulin, their insulin can be stopped as well. That is different for different patient. So if the patient has uncontrolled diabetes, ideally they should be under the care of a diabetologist or a physician to control the diabetes. If their diabetes is not controlled by medicines, he should start insulin, because after the surgery that insulin will be stopped. So he has to control diabetes for the surgery to happen as a fitness criteria. We cannot do an uncontrolled diabetes because chances of leak, bleeding, and infection will increase if the patient is uncontrolled on diabetes and he opts for surgery. Okay. Anything else?
Yes, sir. Even here, my name is Sakshi. Even I
Yes.
was going to ask the same question what Pallavi ma'am asked,
Okay.
because I have uncle who have type 2 diabetes,
Okay.
and he also had weight around 106 or 7 something. So he
Mhm.
was advised to go for this surgery, but doctor didn't uh, go with that, just because he was having high sugar levels, and also it was very difficult for him to recover with anyone, because if any, even if a scratch for him would take like months to get recover from that. So in his case also it was not advisable for that, and only exercises were asked for him to do. So yeah, even that question of mine is answered through Pallavi
But
ma'am's
but
question.
if the BMI is more than 40 or more than 35, he should get a good physician or a diabetologist in his local area. They will control his sugar by temporarily starting insulin. See, what will happen after surgery is insulin will go away. There are
Correct.
chances the insulin will go away. So why we are afraid ki we have a thinking in the mind ki if insulin started once, it will never be stopped, right?
Yes.
That is why people are afraid to start insulin, but they are allowing this sugar to destroy their kidneys, destroy their eyes, destroy their feet. I have seen people having amputations,
Hmm.
like because of blackening of food, because of uncontrolled diabetes. My
Correct.
father has diabetes for last, I think, 30 years. He's on insulin. He is not overweight. He's only 70 kg. He's not obese. But with diabetes medications, with insulin, he takes around 70 units insulin in a day, and he's well controlled. He's almost 30 years, and he's taking insulin for last 7 to 8 years. So insulin is not wrong if taken at the right time, because it can prevent the damage to the kidney. See, somehow kidney is damaged, and he has to go
Yes.
for kidney transplant. Again, they will put him on insulin, and that time insulin will not stop, because even after kidney transplant, if diabetes is not controlled, the donated kidney will also get affected.
Yes.
So it is very important. I am very worried with diabetes because it's a silent killer. It
Yes.
destroys the tissues so badly that it's very difficult to recover. So if there is a chance, if he wants himself to get better, and ask him to meet a good physician who will basically, if he started all the medicines, nowadays semaglutide has also been started for diabetes control, which comes by a name of Ribelsis. So he can try that as well. And with all those things, his sugar should be controlled. And
Yeah,
I
that
would, and when it is controlled, then he can decide whether surgery is needed or not. If he can control sugar and start walking and reduce weight, then it is good enough.
mm-hmm. Correct. Thank you so much. Thank you so much, sir, for this information. And can I ask you once again what was the name which you said about that tablet? Can you just
It
repeat it
comes
once
by the
again?
name of Ribelsus, Rybelsus. The GLP-1 hormone I was talking about, this is the same
Yes.
tablet with the same hormone, and it is for
Okay.
diabetic patients now. A lot of people have started using it. It is
Okay.
FDA approved, also available in
Okay.
India as
Thank
well.
you, sir. Thank you.
Yes, any other question?
Sir, I have two questions,
Yes,
Pallavi
please
again.
go ahead.
So I wanted to ask that how many months before a person, if it is being recommended for them to go for the bariatric surgery, so before going for the surgery, also definitely they have to follow certain lifestyle, diet, and all everything. So
Yes.
1 month, 2 month, how much before it is recommended? First question is this. And second question, I wanted to ask that many a times I have heard that the couple of years bariatric surgery after 2 to 3 years again they have gained weight and
Very
again they have gone for like bariatric surgery. So why like first surgery failed? It is like because of their lifestyle or how?
You have asked a very important and excellent question. Ideally, that is where your role comes into play. That is why these modules are being made. See, when a patient comes for a bariatric surgery counseling to a surgeon, he will only talk about surgery, because every surgeon thinks surgery is the right thing for a patient. But I think it is not correct. Patient should have a cafeteria approach. What does it mean? That he should also meet a dietitian, or the surgeon should ask him whether he has tried non-surgical options before for weight loss, like meeting a dietitian, trying a diet, trying activity. That should be tried first. So they should always meet a good dietitian like yourself. If patient comes to me, I will ask them to meet a dietitian first, like you. And if you are trained, you will ask the history. You will understand the points where the patient is. That is why the patient is gaining weight. It is because of the wrong snacks. It is because he has no activity. Is it because he is taking a lot of sugar? See, all the patients who are obese or overweight, they are very intelligent, though they are overweight, but they know how to hide what they are eating. So I think the diet recall in writing is the best way, like implementation intention, to understand their exact diet. If you ask them to tell me a diet yesterday, they may not be able to tell you everything, because the snacks they are eating like bhujia and all, they don't consider them as foods, and they are the main causes of weight gain. Or alcohol or smoking, whatever they are taking with alcohol, the fried things, they won't tell you. So ask them to write everything like a 1 week diet. Then you will understand their faults, try to change it, and then they will do well. If there are some subset of patients who have tried dieting before, they have regained weight and their BMI falls in the bariatric criteria, they can undergo bariatric surgery. But again, after the counseling of the dietitian and the surgeon, that what will be the diet after the surgery. Module 3 is only for a diet after the bariatric surgery, which I will explain you in detail. So why the weight regain after surgery? Because they don't change their lifestyle. They don't want to walk. They think bariatric surgery is a shortcut. And trust me, it is not a shortcut. If they are doing dieting and they leave you, they go to another dietitian because 7 to 8 patients out of 10, they regain weight. And they don't want to come back to you because they know that you will scold them. Same thing happens after Allurian balloon, which is there for 4 to 6 months. After the balloon is removed, 4 to 5 out of 10 patients can regain weight, and they will not contact their original person or original surgeon because then they think they will scold us, so they will go to a new person. Same thing happens in bariatric surgery. If they regain weight, they may not come back to me for revision surgery. They will go to some other surgeon for surgery because that surgeon will not scold them. So this is how patient has understood how to take care of it. Bariatric after bariatric surgery, initially the weight loss is very fast and the effort is less, but slowly the effort has to be increased. So the weight loss is more and then it is sustainable. So after 3 years or 5 years, even my patients have regained weight. We have tried a lot because there are some patients who may not listen to you. Somehow I realized that counseling or talking to a dietitian every day helps a lot. And I do a lot of support groups every month. They help a lot as well because when they come, they get motivated again and they try again. See, I cannot walk for them. You cannot walk for them. I cannot decide what to eat or drink when there is something besides them. They have to decide it. That will only happen once they are motivated and uh, done a very good counseling by you. Understood? Yes, Uzma?
Yes, sir.
Hello, sir.
Yes.
And I have questions. My first one, is there
Yes,
somebody?
yes. Please go ahead.
Yeah, I have two. The first one is I have seen a lot of young women suffering from PCOD
Mm-hmm.
recently who
Mm-hmm.
have who also have the side, so they have BMIs above 35. But
Okay.
their concern is they want to conceive or
Okay.
they want to have regular period cycles.
Okay.
So if they go for bariatric surgery, will it affect their fertility or
Okay.
their
Okay.
pregnancy?
Excellent. So polycystic ovarian disease in an obese patient is because of insulin resistance, and because of that, they cannot conceive. So once bariatric surgery happens, the insulin resistance goes away because there is weight loss, and the insulin is produced, but it is not working well in case of PCOD. Once the weight loss is there and insulin has a decreased fat to act, it acts on its target organs. So PCOD becomes a lot better and the fertility is increased. Important thing is that time you have to counsel your patient that after the surgery for 1 year after sleep, for 1.5 years after bypass, they should not conceive. Though at that time their chances of conceiving will be very high because that time they are losing weight. Also, the protein requirement is very high. So that time they should not conceive. After that, they can conceive easily. We have a lot of patients who have conceived well and they are doing very well. So just keep them in mind that it is a process. 1 year after sleep, 1.5 years bypass, they can conceive because after the surgery, they will lose weight, their insulin resistance will go away, PCOD will be corrected, and chances of conceiving become very high because their physical appearance also changes. So you have to counsel them. Just wait 1 year after sleeve and 1.5 years bypass, then they should conceive. And surgery helps correcting PCOD as well as chances of increased chances of fertility are there after the surgery.
And sir, will it affect any future pregnancies?
No, 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 not at all. Not at all. It will be like a normal pregnancy after 1 year of sleeve and 1.5 years of bypass. This you have to understand because if they get the baby during that period, the baby then it is small for gestational age. It is a small baby because they are losing weight.
Okay.
So that is not the right time to conceive. They can conceive after 1 year and 1.5 years. Then chances of increased fertility are there after bariatric surgery. That is very important. We have seen our few patients getting pregnant up at 3 months or 4 months after surgery, and then it's a very difficult thing because the child, they may have to abort it, or if they continue the pregnancy, the child will be small for gestational age. So that is not the right scenario. So tell them use barrier contraception that period of time.
Okay, thank you, sir.
Yes.
Hello, sir. I am Lavani.
Yes.
I think this is a silly question or not, I don't know. Is there any side effect after this surgery? Because
Side effect.
I think this is the first question. Um, uh, if we suggest a person that you are going through this surgery,
So you want to know about the side effects of surgery, right?
yeah, yes, yes.
Okay. So Amir will share a video for a complete detail after for the side effect of bariatric surgery. The first
Hmm.
thing is for bariatric surgery, you should control your comorbidities before surgery. Like if you have sleep apnea, then they
Hmm.
should be started on BiPAP machine at least 2 to 4 weeks before surgery. If they
Hmm.
have diabetes, the diabetes should be controlled well. If they have hypertension, they should be started on medication first. This is
Okay.
first thing. Second thing is they should stop alcohol and smoking at least 1 week before surgery. Number three, they should stop all outside food or fried food at least 3 to 5 days before surgery, because sometimes I have seen with my patients as well, a day before surgery they have a party because they think we will not be able to eat for 6 months to 1 year or maybe lifelong, so let's do a party. So they drink and eat chole bhatures and ice creams and all. Then after the surgery there is a problem. So if they do any of these things, then the diabetes is not controlled, then the chances of infection during surgery will increase. Chances of leakage of stapler during surgery will increase. If
Hmm.
they have not controlled sleep apnea properly, after surgery they can go on ventilator because the extubation will be very slow. So they have to be on ventilator for 1 day before extubation. Also, their chances of chest infection will become very high. So if the patient is planned properly, if he has all the pre-surgery conditions are optimized, then the surgery outcomes are very good. It is like any other laparoscopic surgery, like appendix surgery, gallbladder surgery, or hernia surgery. The
Okay.
important thing is infection, bleeding, leakage can happen in any surgery as well as in bariatric surgery. Chances are less than 1% if done properly. I also do a Doppler examination to check for any clotting in the legs, which is known as deep vein thrombosis, just before surgery. Because if there is a deep vein thrombosis and a patient goes for surgery, because we use a DVT pump, the clot will go into the chest and that can become life threatening. So these are the small things which we have to undertake. If we do that, the surgery outcomes are very good and the patient behaves very well after surgery.
Okay, sir. Thank you, sir. Thank you
You have
so
to
much.
tell them no alcohol or no smoking.
Okay.
Because if they start
Okay.
drinking alcohol and do smoking after surgery, leakage
Hmm.
can happen even after 1 year or 2 year or few years. And if they start drinking alcohol, they will regain weight after losing weight.
Okay, sir. Thank you, sir. Thank you so much.
Yes. Any other person?
Sir, are we going to get any PDF or document related to today's
This
topic?
this module is recorded. Amir will share you the recording of that module to everyone. He will share you with everyone, so you can see it again.
Okay,
You
okay.
can see it multiple
Thank
times.
you.
Anything else? So I think in every module we have a small homework where we ask you to do small tasks. So first of all, Amir will send you a feedback form to tell me that what are the things you want me to change. The module 2 will be the Allurian balloon procedure, how it is done. Secondly, I will request you to make 3 charts. You can write it down. Very simple diet charts, and if you do that, it's like preparing you for a patient after bariatric surgery. One is a 1500 calories, 90 gram of protein in a vegetarian meal. All of you are writing?
Yes, sir.
Yes, sir.
Second chart is a 1200 calories, 70 gram of protein in a diabetic male, again vegetarian. And a third chart is 1200 calories, 80 gram of protein in a hypertensive patient. All are male patients and all are vegetarians. And if people they want to make a chart for non-vegetarians as well, they then you will make 6 charts. This will help you once you get a patient, because this is the diet you will be requiring for those patients who regain weight after surgery. Okay, so any feedback from all of you? Did you like the presentation, or it was a waste of time?
Yes, sir, it was
It
really
was
good.
useful, sir.
It was very informative.
Okay, so let us meet next Friday for the next module, and you can clap for yourself. You can come. You can basically clap and just thumbs up. So see you next Friday. Okay?
Uh, So one question, can you repeat
Yes.
the diet chart just one more time?
Can we?
Repeat the
Sir,
diet chart.
can I repeat the diet
Okay. Again.
recommendation, sir, please?
15,
Yes.
1500, patient 1, 1500 calories, 90 gram of protein, vegetarian as well as non-vegetarian diet. 1200 calories, 70 gram of protein in a diabetic male. 1200 calories, 70 gram of protein in a hypertensive male. Okay, understood?
Yes, sir, understood.
Amir will send you. Okay, so you need to make 6 charts. Do it as soon as possible. And just remember this again, implementation intention. So implement in your mind that by tomorrow, 10 o'clock in the morning, you will finish all the diet charts. Okay, try it on yourself. Then you try on patients.